with so much enthusiasm, and then suddenly you remember this is something you have to live with for a while, technically all your life.
The voice you hear is that of a 30-year-old gay man named Echezona, living in Asaba, Nigeria. He asked to be identified only by his first name for fear of stigma, and that Reuters not show his face. Echezona is struggling to come to terms with a life-changing reality. In May, he was diagnosed with HIV. He admits he should have been more careful about practicing safe sex.
That was the only regret I had. I still have.
But Echezona, like millions across Africa, had come to rely on a U.S.-supplied medication that can prevent HIV transmission. In January, U.S. President Donald Trump announced cuts to aid programs that supplied the drug globally. The United Nations has warned of a dramatic surge in new HIV infections if the cuts remain in place.
We may be having 2,000 new infections every day, more new infections every day.
Until recently, Echezona was one of millions of Africans taking pre-exposure prophylaxis, or PrEP. PrEP is normally given as a daily pill, and the U.S. Centers for Disease Control says it can reduce the risk of HIV transmission through sex by 99% when taken consistently. According to UN data, sub-Saharan Africa had 390,000 AIDS-related deaths in 2023, or 62% of the global total. But progress had been made. That death toll was down by 56% from 2010, according to the World Health Organization. That drop in deaths occurred at a time when PrEP use ballooned across the continent. According to the global tracker PrEPWatch, the number of patients who had taken at least one dose of the treatment leapt from fewer than 700 in 2016 to more than 6 million by late 2024. The U.S. financed more than 90% of new PrEP doses last year. The agency that delivered the bulk of the assistance is known as the President's Emergency Plan for AIDS Relief, or PEPFAR. It's the world's leading HIV/AIDS initiative. But Trump ordered a 90-day pause on foreign aid soon after taking office in January, and he issued stop work orders for grants funded by the U.S. Agency for International Development, or USAID. Restrictions on PrEP have coincided with dwindling supplies of more widely used HIV prevention tools like condoms and lubricants, quote, because of the U.S. funding cuts, according to a UN AIDS fact sheet from May. The combination is creating what 9 activists and 3 medical experts described as a major threat to prevention across the continent. And some who've lost access to PrEP are now testing positive for HIV, according to 10 patients, health officials, and activists. 4 PrEP users in Nigeria, all gay or bisexual men, told us they have tested positive since January when they stopped being able to get more pills.
Someone must have committed suicide on getting the news that he or she is positive just because there was lack of PrEP for prevention. Might not take it so well as I am, so I just pray and wish that Trump actually changes his policy and everything comes back to normal, so that the spread and transmission of the virus would be reduced.
The UN AIDS Agency said in March that in East and Southern Africa, a region that accounts for more than half of people living with HIV, the U.S. had been funding nearly 45% of HIV prevention programming. The agency said some countries like Malawi, Zimbabwe, and Mozambique were almost entirely dependent on PEPFAR for their HIV prevention programs. The director of the U.S. Office of Management and Budget told a congressional committee in June that, due to high U.S. debt levels, Africa needed to shoulder more of the burden in fighting AIDS. A limited State Department waiver in February allowed some PEPFAR-funded prevention activities to restart, but only for mother-to-child transmission. Gay and bisexual men, sex workers, and injecting drug users can no longer access the PEPFAR-financed medication. The State Department spokesperson told Reuters that PEPFAR, quote, continues to support life-saving HIV testing, care and treatment, and prevention of mother-to-child transmission services, and that, quote, all other PEPFAR-funded services are being reviewed. Critics of the cutback warn it could put Americans at risk, too. Festus Alex Chinaza is with the Hearty Empowerment and Rights Initiative, a community-based organization that works to provide HIV/AIDS services and help secure treatment.
People are very, very mobile. People travel. So what is the likelihood somebody who is HIV positive in Nigeria might not also travel to the US tomorrow? And they might not also engage in an unprotected sexual intercourse and all of that. So I think they should care, because it's a cycle. And then when we don't prevent and then put a stop to this, it keeps going around.
According to UNAIDS, 1.3% of Nigeria's adult population has HIV, an estimated 2 million people. That's the fourth highest total globally, but a survey completed in 2021 showed the rates in Nigeria are much higher for so-called key populations. 25% for men who have sex with men. Experts say that many African governments don't have the resources to spend on PrEP drugs themselves, risking a worsening of the pandemic. The Nigerian Health Ministry did not respond to a request for comment.
I blame myself because, first of all, there is no right person to blame apart from myself. I am taking care of myself is my first duty as a person.
Emmanuel Cherem is a 25-year-old gay man living in Abuja. Like Echezona, he asked that we not show his face. He's trying to stay fit and healthy in the wake of testing positive.
I will blame myself, and I equally blame the Trump administration because, these things were available and then without prior notice, these things were cut off. And I will equally blame the Nigerian government because I have known that, prior to this moment, we've always been told that, these things were coming from the USA and all of that. So what it meant was that there was no national plan for, for the eradication and making sure that people don't contract HIV.